Hello, my name is Nick, and I'm here to talk to you about taking care of a 1-week-old baby. Tip number 1 is to take precautions against sudden infant death syndrome. Sudden infant death syndrome can be caused by putting your baby to sleep on her stomach or on her side. So it's important to put babies back to sleep. Put their back on the crib mattress when they go to sleep. Also, make sure you don't have any blankets or loose clothing in the crib. And the third thing is to make sure your baby is sleeping in its own crib instead of in bed with the parents. Tip number 2, these are some general feeding tips. So after your baby feeds, make sure to burp her just by gently rubbing or tapping the back of her back after she feeds, holding her against you. You can expect 6 to 8 wet cloth diapers or 5 to 6 wet disposable type diapers each day. And you should expect 3 or 4 loose stools each day in the first week. At first, your baby will lose weight over the first couple of days, but by the first week of life, your baby should have regained their birth weight. Tip number 3. This is advice specifically for breastfed mothers, for mothers who are breastfeeding. So, breastfeeding is the best source of nutrition for your baby. By 1 week of age, your baby should be feeding about 2 to 3 hours, every 2 to 3 hours, and during the day, and every 3 hours during the night. This makes for a total of 8 to 12 feedings every 24 hours. You should not let your baby use a pacifier if your baby is breastfed until they are 1 month old. Tip number 4. This is advice for formula-fed babies. You should expect your newborn to eat about 20 ounces of formula per day, and this usually ranges from, on the low end, 16 to the high end, 24 ounces. Make sure that the formula you give your baby is iron fortified, and give your baby 2 ounces of formula about every 2 to 3 hours. Tip number 5. Don't let your baby get exposed to secondhand smoke. If you smoke, try to quit. This is a great opportunity, the newborn baby being in the house, for you to stop smoking. If you do smoke, do it out of the house. But even if you do it out of the house, you're still putting your baby at risk for infections and for lung disease and heart disease by smoking around your baby. So, because the smoke is still on your clothes, still in your hair when you come back into the house. Tip number 6. When your baby travels in a car, make sure you place her in the back seat, facing to the rear, in an approved baby seat. Tip number 7. Buy a thermometer, and if you think your baby has a fever, use it. Always use the thermometer in the rectum. And know that a fever is defined as a temperature of 100.4 Fahrenheit or 38 Celsius or higher. Tip number 8. I recommend that you learn infant CPR and just call your local Red Cross for classes. Tip number 9. If you're the mom of a newborn baby, make sure that you're taking care of yourself so that you can take care of your baby. A good way to do this is when your baby rests and sleeps, you should rest and sleep too. And let your partner, family members, and friends help take care of you and help take care of your baby. Also, be alert for postpartum depression. Many new mothers experience baby blues in the first week or 2. But if your feelings become overwhelming or if they go beyond 1 or 2 weeks, then make sure to tell your doctor. And tip number 10, believe in yourself. Having a baby is a great thing, and you have everything it takes to be a great mother or a great father. So thank you for listening to this video. I hope these tips are beneficial, and have a great day.